back in studio now, and joining us is Dr. Ben Barankin, who is the spokesperson for the Acne and Rosacea Society of Canada. And this is actually, well, we're about to head into the first ever Acne Awareness Week in Canada. What brought that about?
Sure. So yeah, the first ever Acne Awareness Week is now September 14th to 20th, and it coincides with the start of school, and certainly a lot of teenagers are affected by acne, and there's a lot of social esteem issues and embarrassment related to your skin and other things going on at that age. So we thought it'd be a good time to launch something to raise awareness about an incredibly common condition, and something that has much more impact than just on your skin, but a lot of esteem issues and things like depression and anxiety as well.
Well, it's funny that you should say that, because I had acne in high school, and I was constantly trying to, I think I had bangs and I had long hair, and I was trying to hide my face. I think people have always underestimated, because it's not a life-threatening disease, underestimated the effects of it on children growing up, and especially teenagers who are already struggling with who they are.
Absolutely. About 80 to 90% of teenagers will be affected by acne. And some people have, fairly mild acne, and they can just use some, gentle cleansers and creams and things like that. But other people have more moderate or even severe involvement, and it can affect the face, back, chest. The acne can be sore, it can be itchy. But more importantly, as you said, it can have a lot of sort of embarrassment, depression, anxiety. People have even been suicidal related to their acne. I have a number of patients that have missed weeks, months, and even a full, calendar year of school related to their acne.
Because it has provoked depression.
Right. So not only were they depressed, but also their acne was so severe, they were so thoroughly embarrassed by their skin, and people were making comments, and they couldn't stomach going to school in the morning.
Let me ask you, when I had it, there was nothing much. I mean, I would go to the dermatologist, I'd get a cream, then 3 months later it would be another cream. We just worked down alphabetically the list of creams or whatever, lotions, and nothing worked. But I think a lot of strides have been made, have they not?
Absolutely. There's been an incredible amount of research in acne over the last decade, and in fact we have a whole number of new treatments available, from topical prescription therapy. There's a whole host of new products. There's oral therapy, pills that we can take. We have laser devices. We have treatments like chemical peels, microdermabrasion, photodynamic therapy, things like that. So there actually are quite a few really good treatments now that are safe, that are effective, and ideally, you can try a few things on your own, maybe over the counter, and if that's not doing it, go to see your doctor, go to see your dermatologist.
So are GPs better trained than they were? I mean, let's say we're talking to parents out there now who have children suffering from acne. Can they just take their son or daughter into the GP? Are they more aware, or do they need to go straight to a dermatologist?
I think going to the GP is a good starting point, and I think there's a number of topical therapies that the GPs are now well aware of, and I certainly give a lot of lectures and talks at conferences and meetings to family doctors and GPs, and so I think they are more aware. They are aware certainly of some of the newer treatments, so I think starting there is a good option, and if things aren't coming along after, say, 3 to 6 months, I would suggest a referral to a dermatologist would probably be a good idea.
So can we talk about some of the myths about the causes of acne? I mean, does chocolate cause acne?
It's controversial as far as the impact of diet or food on acne. Historically, we said there really was no impact, and now the data is swinging the other way
Really?
to
Oh,
suggest.
no.
Yes.
It's okay, Christine. You're probably past it. You can have the chocolate.
Yeah.
I'm thinking of a younger me.
So really, they are linking. I mean, because you used to understand that I often thought, well, if you're eating a lot of greasy, fatty foods, then it's sort of probably just oozing out of your pores.
Right.
Is that the case?
So there is certainly some data now to suggest that a high glycemic diet, which is bad for your health in general, is in fact bad for your skin. So those greasy foods, the white bread, the white pasta,
hamburgers and fries
and that sort of thing,
and mac and cheese
likely can aggravate your acne. It's not the
Okay.
root cause, but it can aggravate your acne. There's also some data to suggest that even dairy, things like skim milk, can affect your acne. And in a number of people, even nuts can aggravate acne. Now, it's fairly individualistic, so if you notice that every time I eat this food or that food that my skin flares up, then certainly try to eat less of that or avoid it altogether. But the main things that are lighting up seem to be the high glycemic foods and dairy.
Is there anything genetic? Is it genetic? I mean, are people genetically more prone?
Absolutely. So if mom or dad or siblings had fairly aggressive acne or acne that persisted into adulthood, you're more likely to also have bad acne or persistent acne. Yeah.
So then these foods that you're talking about would be things that would just aggravate something that already you're predisposed to have.
Absolutely. They're more aggravators than root causes. So, the main triggers would be a genetic potential for bad acne or chronic acne, and then the hormonal shift that occurs with puberty.
So is it linked to anything else, the genetic predisposition, like, for example, to allergies or to, because eczema or eczema, depending on how you want to, is linked to allergies, let's
That's
say.
right.
But is that...
Acne is not linked to any allergies.
Okay.
Indeed, eczema is linked to asthma and hay fever, but acne is not connected to any allergies whatsoever.
So, and what about taking care of your skin? I mean, there's the scrubs, there's things, but you can overwork it so that you're actually stimulating more oil, which can make things worse. So how do you learn the balance?
Absolutely. I think most people feel that their skin is dirty and that it needs to be cleaned excessively, and that's certainly not the case. Our suggestion for most people is to use a gentle cleanser rather than a soap, to use a moisturizer in the morning, use something that has an SPF, at least 30. In the nighttime, just a regular moisturizer without sunscreen. Exfoliating is fine once or twice a week, but not scrubbing aggressively. People with acne have, in fact, inflamed skin, and that inflamed skin dehydrates, and certainly some of the treatments that we use are also dehydrating, so we do, in fact, need to moisturize and not be overly aggressive with, harsh chemicals and scrubs.
What do you think about homemade remedies? My trick for my daughters was, and it always seemed to work, but they had pretty good skin, was lemon juice and apple cider vinegar and drop water, and they would just use a Q-tip and put it on, and that really seemed to help.
Sure. So, again, there's different severities of acne, and I think if you get just the occasional pimple and you want to do a spot treatment like that, or there's a number of other remedies on the internet that you can find that are sort of natural or homeopathic, I think that's reasonable to try. For people with more significant acne, acne that's tender, sore, extensive, it's on the face, chest, and back, I don't think you're going to get very far with those therapies. And generally speaking, we want to treat people not just on the lesion itself, but more preventatively. So we actually want to treat the normal appearing skin to prevent the new pimple from coming.
Okay.
It's a lot easier to actually prevent acne than it is to treat it once it's out.
And the ultimate question, to pop or not to pop?
Do not pop.
Do not pop. So you've got to wait, because honestly, there's nothing more satisfying than waiting till that bitter end and then popping it.
Yeah, the popping, as you know, it will aggravate. Not only are you going to get more scarring, more likely, but in fact, in my experience, those pimples will actually hang around longer if you pop it. Yeah, because you incite inflammation when you pop a pimple, and so you'll actually, which will cause the scarring, but it'll actually stay around longer. You might not have that sort of white gunky thing in the middle, which is very obvious, but you'll actually make it last longer.
This is what she said on Canada Talks 167, and we're talking to dermatologist Dr. Ben Barankin about acne. And I wanted to ask you about some of the really heavy drugs, like Accutane. There are a few others where then, you can't take it when you're pregnant. Anything where it says you can't have this when you're pregnant, and it then interacts with other drugs. I mean, it's very, very potent.
Sure.
In what cases do you prescribe something like that? Is Accutane the one? Is that the right one?
Sure. So, with a lot of patients, we'll try, sort of topical therapies, things that are simple and safe and easy to do, but sometimes it's not enough. and they have hormonal acne, it flares with their periods are irregular, or they have tender, deep acne, their skin's already scarring, their acne is extensive, so they have chest, back, shoulders, and face involvement. In those cases, creams generally are not enough, and certainly not on their own. So then we're looking to add typically a pill of some sort, and the main pill options would be oral antibiotics, so typically in the tetracycline family. We also have hormonal therapy in women, so things like the birth control pill or another pill called spironolactone. And then the third main option for pills would be isotretinoin, and that would be like Accutane, and there's a couple other versions. And those are strong drugs, and particularly isotretinoin or Accutane, but sometimes you need them. The person has significant scarring, nothing else works, the acne is extensive, the patient isn't, leaving home, they're, depressed over their skin, and so sometimes you have to get more aggressive. And this medicine needs to be monitored carefully by your dermatologist.
Yes.
There are some blood tests involved. There are certainly more potential side effects, but generally speaking, young, healthy people who take it do very, very well, and I've certainly had thousands of people that have done very well on it without much issue.
And is it a small time span, so you take it, clear it up, and then you go off it? Because it seems to be fairly potent. People are quite concerned about it.
Sure. So typically with isotretinoin or Accutane, we're talking about a 6-month course for most people, and that will make a very dramatic improvement in their acne to the point that at 6 months, I would say more than 95% of people are entirely cleared. Now, the question is, how long will that last? And that depends on a variety of things, including their genetics and how young they were when they started the isotretinoin and Accutane. So there are people that do have to repeat a second or a third course in some cases.
So let's talk about something optimistic. One question. When do people generally, because most people, even with good skin, get a bit of it. So when do normally people outgrow it?
Sure. So, typically acne will start around puberty, sort of 10 to 12 years of age, and most people start to outgrow it around 19 or 20 years of age.
Okay, so for any parents out there, just tell your son or daughter by 19 or 20, if it's not too bad, they should be done.
Yeah, I'm 54, Christine. I still get the odd pimple
Well,
here and there.
yeah, but that's not acne. That's the odd pimple. Hey.
I know, but how unfair is that? I've gone through menopause and I'm still getting pimples. This just doesn't, it's not good.
It's not fair.
It's not, life isn't fair. Thank you very much for coming in and talking to us.
My pleasure. Thank you both.
Click the channel subscribe button for full-length interviews and more from What She Said here on YouTube.